Hey guys, do you work in emergency medicine? An absolutely crazy and intense environment where you see things every day that a regular person doesn't see once in their entire life? You feel burned out, unappreciated, like there's no one you can talk to about the things you are struggling with? Well, you are not alone. I have a bunch of real professionals with real stories here with me today that can relate to your struggles. I've struggled with burnout, discouragement, frustration many times and still struggle with it. My name is Aaron. I've been in emergency medicine for 15 years as an EMT paramedic and now emergency medicine PA, and I am the host of Practical EMS Podcast. And with that, I will introduce my guests and we will get started. Anybody have some stories about failure?
You know, as an ER doc, it's like you're always worried to talk about cases you failed at, whether it's been a litigious situation or whether it's just a personal attack on how good of a doctor you think you are. And, over my career, I can probably count for sure on both hands, maybe on one hand, the times that I look back at a case and I say, I really didn't manage that very well, and I could have done better. And, there's been a few. One was a trauma situation where it was an adult person who came in after an injury and had a transient hypotension episode in the field. Vitals were pretty much normal when they got to me, but they had an orthopedic injury that precluded them from really being to lay down easy. And it was a hip dislocation. And I thought, I did a fast exam, looked normal, vital signs looked great. Person's, middle-aged to younger, healthy. I think, okay, let's just put this back in real quick so that they're comfortable while they're getting their next 30 minutes worth of scans. So I decided that's the right thing to do at the time. And so it takes me a few minutes to get that back in. It wasn't real easy, but we were able to get it in. But by the time I got it back in and got him to scan, we realized that he had a significant intra-abdominal injury that I didn't find, and it didn't show up on the FAST. So he goes emergently to the OR and basically, almost died. It
was like a liver lag.
It was a spleen injury.
Spleen.
And, I beat myself up over that for such a long time, thinking, I'm a horrible doctor for missing that. I didn't follow the protocols. I didn't do this. I didn't do that. And it really took a long time for me to get over that. And there's been, like I said, probably 4 or 5 of those in my 25-year career that I can look back at. But, it's hard to be right all the time, and none of us are. And it's hard to be humble about knowing that you screwed something up. And that's one of the hardest things for me in this job is when you feel that you didn't do quite the right thing, although everything worked out okay, you still beat yourself up over it. So most of the time I'm able to, finish my work, go home, leave work at work. I don't take it home. I don't usually dwell on it. I don't think about it. That's why when you talked about, let's think about cases, I really had to kind of think hard about those because I try to forget most of them, really. Whether they're good or bad, just because I don't have the capacity to just relive those all the time. But, having someone to talk to, as in your spouse, about a case that you did, because for a long time I'd hold in, I wouldn't say nothing. She'd say, "Why are you in such a bad mood?" I'd be like, "I'm fine." It's kind of that whole "I'm fine" mentality.
Ooh, I could talk about that.
Yeah, you don't want to admit that you did less than you thought you were capable of, because you don't have a good explanation for why you didn't do the right thing. So, there's been a handful of those. That's probably one of the more serious ones that I can think of. I mean, there's another one of a, abdominal pain in a female that, when I'm reading through the labs, I thought I saw something that said negative, and it did, but it just wasn't the same result that I expected it to be. I thought there was a pregnancy test listed there that said negative, but it was way down on the urinalysis, but it was negative for some other stupid thing that wouldn't even have mattered. And it hadn't been a pregnancy test done. And they always say ectopic's one of those things you should never miss. Well, I missed one. And it's like, I look back, I'm like, how did I miss that? And I, in my mind, I rationalized, I must have looked down, I saw the negative, and it ended up, she ended up having to come back and have the right thing done. And, it was hard on her. And that was another case I beat myself up on for a long time. So it's like, those are probably the 2 cases that I can think of that really bothered me the most in my career.
Yeah.
So,
and that's the one thing, like people look at, docs, hospitals, red and blue lights, and we're supposed to be perfect.
Right.
Human error is real, and we're humans, you know? So, oh yeah, sorry. And then I have a story too. This was when I was on night shift. Like we get there and the trucks were there as well, of course. And this woman's walking out and then the other responders were pretty much just saying it's like flu-like symptoms. And we're like, okay. So it's like 3 a.m, one of those. So then my old partner was like, Nate, just start driving. I'll figure this out. And I'm like, okay. So not even 5 seconds down the road, my partner's screaming, pull over. And then I was like, why? And he's like, we're in V-tach. I'm like, oh shit. So I come around the corner, open the back. My partner's putting pads on and you just see the big old McDonald's symbol doing this. And then like her BP's like 60 over nothing, you know? So it's like, I mean, we ended up lighting her up and fixed the problem. But, you know, if we would have took a second to be like, let's pause here for a second and get out of that. It's 3 a.m. I'm exhausted. Why are we here? And the sibling was not being the nicest to us. So that kind of like made us go like, okay, right. We're just going to go, right. You know, but you know, like, you know, she was as white as your monster can, you know, her just cardiac, you know, but both me and my partner after that, we were like, we almost fucked up. Like we were both like, we should have kind of taken a time to like, even if the other responders are like, hey, this is flu-like symptoms. Okay, but let's do our own assessment. And then because they didn't do vitals, so we didn't have anything other than her walking out to us. Yeah. And then, I
mean, bias is a real thing.
Absolutely.
In emergency medicine. And that's one of the big things that I always try to, you know, when we have a student or anybody else or, you know, anybody newer, whether it's one of our nurse practitioners or physician assistants, I try to talk about never be biased by what anybody else has told you, whether it's whoever brings them in, whether it's a family member, whether it's they've been here 26 times in the last 37 days, It doesn't matter. Try to get rid of the bias because that's where you're going to get in trouble. That's where you're going to miss stuff. So.
And especially with those people who are there all the time or, you know, that call every day who are at the hospital 72 times a month. Yeah. And then, or they leave the ER, call 911 for us to like hospital shop to another. But it's that one time you're like, you hook them up or do an EKG and all you see is tombstones and you're like, oh, fuck. Right. You're actually having a problem.
One of my docs when I was a resident said something. It's probably one of the few things that I ever remember from residency of someone specifically telling me. And he said, Doug, the waters are deep. Never forget that. Yeah. So he's like, you know, the waters of emergency medicine are deep and you're going to be walking along in shallow water and then all of a sudden it's going to be deeper than your head and never forget it. Yeah. So.
Yeah. Dr. Les talked about that last time a little bit, kind of the bias that EMS tends to pass on to the ER provider and how we got to start with this much broader consideration. Like it's great if you think there's a specific diagnosis, but that doesn't really help me. We got to start with a broader workup. That could very well be what's going on, but we've got to prove all these other things aren't going on first. So it's great that you think it's anxiety, but we've got to kind of prove this isn't ACS or a PE, you know, and sometimes that's, you know, we can prove that with a good physical exam and a good history on the patient. But, you know, we do have a little bit broader, you know, workup to start with. So the more objective you can give report to the ER provider, the better. You know, the crews that tend to pass on their bias, and we can all probably think of specific crews, tend to pass on their bias more than others, and it's just not helpful. You know, I like to know your thoughts on the patient and what you think's going on, but I don't want that to color my workup of the patient because we all need to see him with fresh eyes. And so I think it's more helpful when you can give a very objective report to the ER provider and keep the bias out of it. We're all thinking probably what you're thinking anyway.
But at the same time,
we don't need help. Yeah, exactly.
Yeah, I mean, whenever I first started, like with my first partner, he's been in medicine for 20 years. Like I was lucky as hell to get my very first partner. Like he taught me ALS, ACLS, all that stuff. And whenever him and I went over assessments, it's like 6 months. I'm fresh out of the academy. He's like, Nate, after every call, I want you to give me 3 things. Because now I'm starting to learn ALS, medications, pathophys, pharmacology, blah, blah, blah. He's like, what you think it is, what it most likely is, and your Dr. House shit. And I was like, what's that? He was like, the one thing that's going to kill them, prepare for that. He was like, if they have a headache and they are hypertensive, worst cases, they're having a stroke. You know, if they hit their head on the ground and they're not responding, cool, they might have a concussion, but worst cases, they're bleeding in their dome. He's like, prepare for that because that will happen. And then he also told me, and whenever I was training people, I'd tell them the same thing. If you don't know what to check everything. you can't go wrong with it. You can never over assess a patient. I don't know how it is in hospitals, obviously, but like, you know, whenever I was on the rig, you do the BP, the pulse ox. I don't know what to check. Cool. Blood sugar, capno, EKG. Like, is their capno low? Are we acidotic? Are we alkalotic? You know, and then you can dive into that a little bit. That's what I've learned and how I've grown, kind of thing, other than all these big words you guys are all throwing around.
No, I think that translates to the ER, because if you can't get a good history, if you can't get a good history on a patient, they're demented or whatever, you don't work them up more narrowly. You expand the workup. So you do more of a workup in, you know, a case of a limited history. If the patient can answer all your questions, you don't have to order every test you can think of. But if the patient can't answer anything, then you need to order a lot of tests to get more information. Sarah, do you have anything about failure?
Hi, Sarah.
Hello.
Hi, Sarah.
I definitely do. It almost daily feels like there's an area where you could improve, especially in the whole bias. I do appreciate you sending the prompts because, like you, Doug, I definitely try to keep things at work. I definitely walk out, and unless it's a very monumental case or something that really resonates with me, I do not bring it home. But the big ones I feel like are always early in the career where you really have that sentinel moment of, wow, I really missed this, or I could definitely improve, or I can't believe I did that. And I think those are good moments because we all hopefully strive for excellence in everything we do, and we don't want to be missing anything key or very obvious. But we all are capable of it. And given any kind of combination of scenarios, we could be like anybody on the news. And that's where our systems really come back into place, where you always do this with every single patient. So you know that it will keep you in hopefully a safe, protocol-driven situation. But I think of two big failures that I had. One really early on in my career with my first job as a nurse. I was night shift, and I counted up all the experience that we had on the entire floor, and even with including the charge nurse, we had less than 2 years combined.
Oh,
That's
wow.
every single nurse. And that kind of gave me a moment of pause of, whoa, wow. We are
Right.
Everyone's
all
red in
very
the face.
green. And that helped me because I knew not to expect a level of expertise that just wasn't going to be there. And sure enough, it became very evident in my first code rather, where they hit the code blue button and I'm running into the room and the patient's blue, not breathing, and we're starting CPR. And it feels like forever until the rest of the team shows up. But truly, it was probably less than 3 minutes. And we're halfway into realistic BLS because we're not doing ACLS at that point. And the ICU charge walks in the room. She's like, did we ever check a pulse? And everyone just stopped. And I was like, wow, no, definitely didn't do that. And I tell that to all my students too. I'm like, you are absolutely capable of messing up, and take that moment to learn and do better and do what's best for the patient. The patient definitely needed a lot of help. But as the story evolved, it was a situation where maybe she might not have needed compressions. She did fine.
Ow.
Exactly. And she went off to ICU. She had a pretty quick recovery. And it's one of those moments of like, when you see someone who's seasoned and worked for a while, like, have you ever messed up? Oh yeah. Didn't even check a pulse. And those are just kind of moments to like share with, especially people who are new in their profession, or even just moments to keep in mind that I was capable of that once and I could be capable of that again. Hopefully we'll learn from that lesson.
Everything you hear today from myself and my guests is opinion only. It does not represent any organizations or companies that any of us are affiliated with. The stories you hear have been modified to protect patient privacy, and any resemblance to real individuals is coincidental only. This is for educational and entertainment purposes only and should not be taken as medical advice nor used to diagnose any medical or healthcare conditions.
And then the second big area that I personally take a lot of accountability for is in the team environment. We have excellent doctors. We have amazing EMTs. We have such a great teamwork, in my opinion, where we work. But my responsibility really does involve advocating for the patient when they don't necessarily know what is going on at all. And I was very new in the trauma base, and we had a very brutal attack come in, and this patient had all sorts of wounds everywhere. And I think we in healthcare get very complacent with our expertise and lose that humane side sometimes of what the pain is like for that patient. Have you been on the patient side of that before or recently? And one of the specialties was coming down to take care of some of the wounds before the patient went off to OR. And they were gearing up to do a bedside washout, essentially. And this patient was in excruciating pain to begin with, but really tolerating it very well. And I could see them getting everything together and no orders for any kind of sedation. And I went up to the providers and I was like, wait, what are we doing here? And they're like, we're just going to do a quick washout. I'm like, can't we do something? And they're like, no, this is going to be so quick. It's going to be fine. And I'm just sitting there and I'm like, no, it's not. No, it's not. And the patient doesn't even know what's going on. She couldn't even tell what was coming next. Yeah. And I was so fresh. I went up again. Like, can't we do something for the pain? They're like, okay, 25 of fentanyl. I'm like,
just waft it by her nose.
Yeah.
How about you do that? Add 75, then we'll talk.
And I gave it. And then honestly, I was so frustrated with the situation. I walked out. And as I was walking to talk to our charge, this unearthly scream came out of the trauma days. And the charge was like, what's going on? And I was like, and I shared with him what I was frustrated about, what was happening. And he walked into the room and he's like, stop. We're not doing this anymore. And I saw that and I looked at it and I said, I should have done that. I mean, that's my trauma bay. That's my patient. I know them. I can tell how they're tolerating. I have the power in that moment to stop. And sure, it could get me written up. Sure, it could get me in trouble. But I know I didn't do what was best or what I would have wanted. And that was a big moment of learning for me, that I have the power to use the full extent of my voice. Even if I voiced something, you typically take it a little bit further.
If it makes you feel any better, I did something that I shouldn't have, and he lived, and I got fired, and I don't fucking regret it. Yeah. I don't regret it.
It's honestly what you live with yourself. If you've done your best and you went to the extent of your knowledge base, that's something you can live with. If you genuinely didn't know better in the moment, okay, now you do. Know better, do better. If you didn't know better, hopefully now you can improve on that. But if you knew better and you chickened out on yourself, that's what's a shame, because our people in those situations deserve better.
Absolutely. Yeah, that's good. Let's finish this segment by going around and just saying, one more. Yeah, well, you can speak again, I guess.
Only if it's okay with you. This is a funny one. I fucked up an IO, and then the saline came out of the kneecap.
Hold on, you can't just. You gotta give us the whole. You gotta give us the whole story.
All right. So in my defense, okay, it's the first IO I've ever done, and I didn't want to be a failure. So we were with my old partner. It was one of my first cardiac arrests. To help you out as well, I did 30 and 2, and everyone just stared at me like, why are you fucking stopping? We do 2 minutes here, and I'm like, oh, didn't know that. So I owed him in the left, and I missed. Okay, I fucked up, but I didn't want to admit that. So I owed the same place again, just a little bit higher. So we go in the recess room, and I see you guys pushing meds, and all you see is just shooting out of the top
from the old hole.
From the old hole, and I saw all the docs and everyone looking down, and I'm just. My old partner, Mike, he's like, Nate, was that you? And I'm like, no, that wasn't me at all. And he's like, so we're going to talk about why you fucked up. And I told him, I was like, you told me that wasn't funny, though. He's like, I wasn't, because you guys were pushing happy. It was funny.
To wrap up the segment, then, what advice would you give somebody, a new coworker, a new physician, a new nurse, new paramedic, new EMT that has failed at something? What would you tell them to do to help them kind of move on with their life?
So my personal opinion, I actually saw this from a follower of mine and I loved it. The word fail, first attempt is learning. I love that. And he was like, yeah, because he was a doc somewhere in the other states. And I was like, man, I got to take that. Like, that's beautiful. Like, your first attempt is learning. And
I
like
like that.
you need a foundation to learn. Failure is a foundation. Now it just means like, okay, that happened. Learn it for later. I love that whenever I read that. So that's mine.
Yeah, that's good. Anybody else?
I mean, no one does things right every time. And, a lot of the motivational quotes or whatever, if you see it on Instagram or Facebook or whatever it is, they talk a lot about failure. And basically that's how you learn. And each of those cases that I talked about, I learned a lot from them. And even though they were really hard for me to swallow, when you basically take accountability for those things and you say, this doesn't define who I am. It just defines what I did that day. And I'm going to move forward from this knowing that I'll do better the next time, because that's all you can do. It's if you are someone that you can't get over those things, no matter what you do, no matter how hard you try, who you talk to, whether it's your spouse, whether it's your coworker, whether it's a therapist, if you can't get over those things, then this isn't the job for you. But usually with one of those mechanisms, you can get through this, even if it's a really bad outcome. And I've had a lot of partners that have been sued over things that they didn't think they did wrong. And part of the time I agree, they didn't do anything wrong, but it still really was detrimental to them. And it really hurt their career more emotionally than anything. But once you get back on top of your game and you realize, this is what happens. Things don't go right. Life isn't easy. It's not always fair. And it's going to happen to you. And if it hasn't happened yet, as a doctor, as a nurse, as a paramedic, it's going to.
EMTs doesn't happen.
EMTs doesn't happen.
Does it? Yes.
But it's if you haven't screwed it up and had someone come down on you for that, it's going to. I got really used to that when I was a resident, because no matter what you did, you were always wrong. So that ingrains it a little bit in you. So it's hard to talk about when you're a staff. But for what that's worth, it's like, have someone to talk to. That's the thing that's helped me the most. Having a spouse who's also in the medical field who understands the pitfalls, understands the way I feel, understands how hard I am on myself. And then having coworkers who also understand and are willing to talk to you about those things is probably the two best things for me.
Yeah.
Yeah, I agree. I think for me, my advice would be that you're going to make mistakes. There's just no way around it. Yep. You're going to. I think our field training programs that we've had in the past were kind of like residency, where you couldn't do anything right. And that's not good. So we've changed that. And so now we have the majority of our field training officers are those kind of people that are really great resources, and they can instruct. And when somebody messes up, you can come to that FTO and go, hey, I really messed this up. Let me pass it by you and let me, see what you think. And instead of saying, yeah, you really screwed this up, well, let's look at it and look at the, so they can teach from it. I think the other thing that I would say is when you make a mistake, own it. Own it. I'm a big Jocko Willink, Leif Babin fan. They were Navy SEALs, and they've got books out.
Extreme
Dichotomy of Leadership and Extreme Ownership. And Extreme Ownership is such an eye-opener. And it's a great book if you get a chance to read it. And I listen to them because they actually narrate their own book. And so it's really great to hear their emotion. And they talk about mistakes that they made in the war in Afghanistan, and how they overcame those things. But they always hammer in, take ownership of it. Even if you're not making the mistake, sometimes you take ownership. And I've got a pretty good relationship with the guys in the big trucks here. And one of the reasons I think is because I try to give credit away, and I try to take on those things that those mistakes that get made. And so, people come to me all the time, what do you think about this? Because they know I'm not going to judge. Yeah. And I think that when you take ownership of mistakes and stuff, that makes you look better in everybody else's eyes and in your own eyes. I mean, I can look at myself in the mirror and go, yeah, I screwed that up, but I'm never going to do it again. So if you start making the same mistake over and over, you probably should think about something else. But yeah, you're going to make mistakes, and you make it and you learn from it and you don't do it again.
Right.
So
Yeah, I'll second the Jocko book. Extreme Ownership is really good.
Yeah.
That was going to be kind of my big tip, is just to own it, because people know when it's your fault too, and people aren't going to respect you if you point fingers and try to blame something else, or it was chaotic, and like, it's always chaotic. We deal with chaos every single day, and if you don't take responsibility for it, people aren't going to respect you, because we all know whose fault some of these things are, and maybe it's a group failure and we all miss something, but at the end of the day, if you're not taking responsibility for it, you're going to lose respect. And so I think that's a big component of it too.
I agree. I think another thing too that I'd like to touch on just briefly is that we tend to be hardest on ourselves. If you're worth your weight, you're hard on yourself more than anybody else is. And I think that I have people, say stuff to me all the time, like, your guy with the spleen, was it encapsulated? No. I mean, but what I'm saying is,
It was bleeding freely.
Yeah,
Thank you.
But what I'm thanks.
Thanks.
I'm just saying, you miss things, and you say, yeah, but a lot. That's a big, huge thing. Yeah, but did you think about this? Did you, yeah, but you got it. Yeah, but. When you start an IV, paramedics all the time and EMTs all the time, I missed that IV. Well, you missed it. So what? Did you put the tourniquet on right? Yeah. Did you clean it off right? Yeah. Did you pick the right needle? Yeah. Did you come at the right angle of attack? Yeah. Did you get in the vein? Yeah. Did it blow? Yeah. Well, that's not your fault.
Okay.
You did your job right. There's no accounting for the patient's cooperation and their vein. Don't beat yourself up over it. Yeah, but.
Right.
So we do that a lot.
I think a lot of it can come back to is people don't want to be seen as a failure.
Yeah.
So it's gone. Sorry.
Yeah.
I haven't yet. ADHD med, not kidding. I forgot to take it. Sorry. It was there, and then literally it's like walking through a door and you're like, why the fuck am I here again? That's what my brain is. My wife hates it.
I think, thirding the ownership and the failure. I don't brag on it, but I definitely speak about my failures to the point where, yes, I'm not perfect. I'm human and I mess up. And hopefully then that can help me be one of those safe spaces where when somebody messes up, they can come and they can talk to me, and I'm not going to judge you. And hopefully things can be rectified and they can be corrected in a timely manner. But I've been made to feel so small when I've messed up before. And man, nothing makes you want to hide and not share anything further than that. And so I think one of the ways that I cope is by freely talking about the things that I mess up, or that's not my identity. I am a solid nurse. I know what I'm doing to an extent, and we are strong as our team. And when I mess up, that's a learning moment, and that's not a defining failure on me as a human being. I am going to mess up, and that's not something I strive for, but it's an expectation that I am just as flawed as anyone else, and hopefully we can be pushing each other towards excellence in sharing when we don't meet the mark.
All right, guys, I'm going to jump in here. I want to thank everybody on the live stream. If you guys got any value out of this today, and don't worry, guys, we're going to keep talking, but if you got any value out of this today, if it resonated with you, if it encouraged you, the only thing I ask is you subscribe to the show on whatever podcast platform you're listening to. Give a 5-star review. That will help a ton. I don't make any money from this podcast and actually pay a fair amount of money to do it. So if you can support the show, that'll be very helpful. If you go to practicalems.com, you can join the email list so you know when all the episodes are coming out. There's an EKG course on there as well if you want to financially support the show. And we'll jump back into the conversation with these folks next time. Thanks, guys.